carpal tunnel syndrome solutions. Pain in the wrist, numbness, tingling, blood flow issues, cold, and so forth, swelling possibly. Let's talk about some conservative solutions that might work for you here. Now keep in mind, I'm not talking about the person that may need an emergency decompression of the median nerve and the blood vessels in the wrist. There are occasionally that happens where blood flow is very much disrupted in the wrist. The temperature is very cold. There might be some swelling and so forth. There can be cases that emergency decompression has to occur. I've read about cases like that. I've not had one, but I've certainly heard about them from other doctors. I'm talking about everybody else that might start to develop over time symptoms. A lot of it is from keyboard work, phone work, gaming, and so forth. Even labor jobs that have repetitive motion. And keep in mind that obviously these hand symptoms that people can get, pain, numbness, tingling, temperature changes, swelling, and so forth, they can be some fingers in the hand, it can be the whole hand, it can be in conjunction with wrist pain. You can also have symptoms that go up the forearm. It can be on one side, it can be on the other, it can be on both sides. But keep in mind, not all the problems are right in the wrist itself. It can be, it can throw a curveball at you and come from other areas. So if you think of the nerves that have to go all the way down to the fingertips, they originate in the lower part of the neck, And you have a bunch of branches that come off the spinal cord in the lower part of the neck that come together and with a bunch of root systems, if you will, through the neck and shoulder area, and then they come down the arm and feed the hand and fingers. Kind of like a garden hose snaking through your lawn, that garden hose can be compressed at many points along the path. The same thing with nerves. They can be compressed right at the neck itself where they branch off the spine. The nerve holes that come out of the spine itself can squash that nerve. So that can be caused by a neck problem. It could be a disc irritation, loss of osteoarthritis, inflammatory and degenerative conditions in the neck can cause that. And it can skip everything between and happen down the hand. That's a little more rare, but it can happen. A lot of people will have a numbness, tingling, pain, pins, needles, whatever it is, all the way down the arm from the neck. Now, these nerve fibers can also be trapped on the muscles of the side of the neck called the scalene muscles in here. I do quite a bit of scalene work in my office where I am breaking up scar tissue and tightness of these scalene muscles and releasing the entrapment of the little nerves that are exiting through these muscles in here. The nerves can also get entrapped underneath the collarbone or clavicle here, where it approximates the first rib, which is just below it. So the two of those can be compressed. There's a variety of things that can happen there. You can have a rudimentary rib off your neck that can cause some trouble. The space in here can be a little constrained in certain people, malformations in the clavicle and the first rib. But what I found a lot of the time is the soft tissue in between the clavicle and the first rib can become scarred up and so forth. Well, that's going to be caused a lot by this kind of work, right? Compressing us forward, scrunching down the pec muscles and so forth, and cause a lot of disruption in the area here where the nerves come out. So I, again, work a lot on the muscles just below the collarbone in here and release the entrapment of the nerves here, which can relieve all the symptoms down here as well. It can get entrapped in the shoulder. There can be some more rare cases of entrapment in the elbow, but that can happen. And then, of course, it very much can happen at the wrist itself. Now, you've got a ligament that goes across the wrist like so, and then you have nerves and blood vessels that go underneath it in this tunnel underneath that ligament, between the ligament and the bones, carpal tunnel. That tunnel can be compressed and inflamed and so forth. And that can compress the nerves right there in the blood flow and cause the problems in the wrist. So a proper diagnosis is very important, right? To find out, well, why are we having tingling down here? What is it? Could it be a metabolic problem? Could it be a blood flow issue from elsewhere? Can something else be compromised? Or is it a true compression along the pathway of these nerves? So getting a proper diagnosis can help a lot. I've seen a lot of people come into me with diagnosed carpal tunnel syndrome, and they've had a lot of treatment here in the wrists, even surgery in some cases, and it's still a problem, but it was actually up in the neck, or was in the scalenes, or in the clavicle, or in the shoulder, or elsewhere. So we find that a lot of these things can really help. I'll talk about treatments in just a moment, but let's talk about some things that you can do at home on your own. There are two exercises for the past 25 years that I have taught lots of people that seem to work really well. So if we're pounding away at a keyboard like this, we're working the flexor or the front muscles of the forearm. We're working the front muscles right in here. Okay? These are called the flexor muscles, and they do this with the fingers. Or if I turn my hands over, they're pounding away at a keyboard, using our phone, doing detailed work and so forth. So these front muscles here become stronger and tighter, and the backside forearm muscles become weaker. So now the teeter-totter of the wrist is influenced, and the front muscles are becoming tighter and stronger. The ones in the backside are weak. Had great results by strengthening up the weaker extensor muscles on the backside of the forearm here. Here's a couple ways to do it. Starting off now, if you have a condition that is really severe, you might actually have to start this with no weight. So supporting your forearm, you could be doing both, doing your affected side only, but you might just have to start with your forearm on a table, for instance, as I have here. And you might just end up doing this exercise with no weight if you're in a serious condition. Okay? So you do no weight like this and do what I'm calling a reverse wrist curl, a reverse wrist curl. And you might do a set of 10, 3 times a day. Okay? If you can handle a little bit of weight, you might start with a 1-pound weight, maybe a bottle of water, hopefully more of a stainless steel container and not plastic, and you can do a reverse wrist curl. So I wouldn't start with too much weight. You want to start with you're feeling it a little bit, and there you go. This is a 3-pound weight here. Many of you might not even start with this. You might start with 1 pound or bottle of water, as I suggested, and maybe do 3 sets of 10 during the day to get started. And you can increase the weight as you see necessary. Now, these are small muscles. They don't need much weight. Most of you probably won't even get over 3 pounds, maybe 5, most of you. Some of you might get a little bit more. But that's all you need to do. If you're having trouble on the other side, then do one at a time. Do one at a time as you're doing this exercise, one at a time. 3 sets of 10 spread out through the day would work out well. That's a reverse wrist curl. So that's going to be number 1 on our list of things to do. A reverse wrist curl is the first exercise that you want to be doing at home. Second one is the rubber band exercise. So once again, the flexor muscles are strong. The extensor muscles, which would open your fingers, are weak. Take a postal rubber band around the distal fingertips. There's a couple things about this exercise. You obviously don't need a lot of resistance to do this one. As you do it, notice that I'm pretty good at it. I can spread my fingers relatively equidistant all the way around. So part of the exercise here is to be able to open your fingers against the resistance, but keep them spread. A lot of you are going to find you don't really have the coordination. I'm telling you that's exactly what you need to do is this exercise. Okay? You don't need a thick rubber band to start. And what I want you to do is open against the resistance, hold for a couple of seconds and close. Open against the resistance and hold and close. You might only need 3 or 4 of these. A couple of hours later, do a few more. A couple of hours later throughout the workday, and there you go. Do one at a time if you're doing both sides. Go slow and take your time. The other thing too is if you keep your fingers straight, you'll see that my rubber band will not stay in place. You have to keep them slightly curled, slightly bent. So when you keep them slightly bent, the rubber band will stay in position when you're at full extension, as opposed to straightening them out like that, okay? So this will take a little bit of practice, but this is a fantastic exercise to work some of the detailed work that's going on with your hands and fingers and build up a little bit of strength in the extensors. So that's number 2 is the rubber band exercise. Number 3 is stretches. Be careful with these. If you're having a wrist problem, check with your doctor, check with your chiropractor, check with your therapist, whoever's overseeing your care. Make sure that the first 2 exercises and the stretches are appropriate for you. Go slow and go careful. Now, a lot of people will will get benefit by stretching their forearms down like this. This would be stretching the extensor muscles like this. Go nice and gentle, comfortable. And the key with this is not stretching for 3 seconds and then thinking that you're done. A light stretch for 15 or 20 seconds is much better. And then, of course, you can go the other way. Only to tolerance. And if this is uncomfortable, back off. If it's still uncomfortable, back off some more. If it's still uncomfortable, scratch it off your list. Wrist stretches in both directions, and there you go. Some people also like wrist circles, like so. You might even do this if you're, again, at your computer a lot all day long. Maybe you do some wrist circles in both directions. You can do them with fingers open or closed, okay, just to warm up those tissues in and around the wrist. Again, only to your tolerance. Number 4. We have to talk about number 4, and that's taking care of your spine, okay? So many of us are in front of computers and phones all day long. Here we are, causing compression on the neck structures, the nerve holes coming out of the neck. Bringing your head forward strains the neck muscles and tendons. The scalenes get involved. The clavicle comes down on the first rib, causing compressions in here. Rounding the shoulders, shortening the front muscles, the pec muscles. The tendons get short and inflamed, and so forth. You can see how this whole deterioration process affects many of the compression sites in this carpal tunnel. So you're affecting all of this. Get into your spine stretches. We've gone over this many times on this show here. You can go to my YouTube page to learn how to stretch out the spine. You can go to my website for all kinds of information. My book, Happy Back, will go into improved postures, sitting ergonomics, and so forth. But a couple of the stretches are making sure you're doing your spine stretches, right? Twists, or even you can just twist your neck itself with a nice upright posture. You've got side bends, or you can just side bend the neck to keep that stretching, right? And if we're always forward like this, what's the other exercise we need to do? That's right, an extension exercise like this, getting the shoulders down and back, and the head up to comfort, no pain, and hold 10 to 20 seconds, maybe 1 per hour during the day. Those are just some great stretches in here. One of the best ones that we've been really working on with a lot of patients in the office is tall wall. I've demonstrated it before, sitting or standing. You're pulling yourself up tall like this, thinking straight, trying to slide my spine up toward the ceiling, but keeping the shoulders down. So if you look at me scrunched, the shoulders come down, but the spine goes up. I'm trying to elongate just like this, using literally a wall to go over and lean against. So your heel, your rear ends, your shoulder blades, and the back of your head touches the wall, and then you try to slide the spine up the wall, but making sure that the shoulders come down. That requires a little bit of work for most of you. It's a little bit of an art to be able to pull the shoulders down, but extend the spine straight up at the same time. Wonderful spine stretch. Don't ignore the spine in dealing with carpal tunnel syndrome. Number 5 on our list here, number 5 is sitting breaks. So again, sitting all day like 8 hours, that's always going to win. So we have to take breaks, take frequent breaks. I would much rather have you take a 20-second break every 20 minutes as opposed to taking 1 minute break every hour. Frequent breaks really matter. Frequent breaks to get up, frequent breaks to do your exercises, the reverse wrist curl, the rubber band, the spine stretches. 20 minutes, no more than every 30 minutes. Take sitting breaks, and that's going to maintain your spine, your tissues. Take a break with your wrists, and so forth. Number 6, many of you just need appropriate treatment. I have soft tissue treatments that I do in the office. Being a chiropractor, I'm going to address the spine, shoulder, clavicle, scalenes, elbow, whatever it takes to identify those entrapments. So we need some in-office treatment, chiropractic therapy, and so forth. Sometimes acupuncture for some of you works really well. And massage. Massage can work really well if the therapist is going to work all the way up and down the arm, can touch on a lot of these points as well. Number 7 on our list, keeping in mind that I have a laser, low-level laser therapy, or LLLT, oftentimes just called cold laser. I can put the light laser on the wrist. I can do the elbow. I oftentimes will do the entire nerve pathway from the neck all the way down to the wrist. For a lot of people that have had other treatments that haven't worked, I pull that one out of my toolbox and I use the laser. And then the last 3 are overlooked as important for any neuromusculoskeletal problem that's going on in the body, and that is number 8, nutrition changes. Can't tell you the number of people when they clean up their diet, weeks and months later they'll say, wow, my plantar fasciitis is gone, my carpal tunnel syndrome is better, my neck issues are better, my headaches are gone, my migraines are better, my digestion is better, my skin cleared up, and on and on and on the list goes. I have more energy, less brain fog. Well, there's people literally that when they go on a campaign of eating cleaner, they remove systemic inflammation and swelling, and you remember that tight little tunnel in here, a little bit of inflammation decrease, all of a sudden the nerves aren't compressed anymore, yay! So sometimes it's nutrition changes that make it. Number 9 is anti-inflammatory supplements. You can add that to your list. So we're talking about omega-3 fish oil, antioxidant blends. I've had great results with magnesium and for some people zinc. So antioxidant supplements, vitamin D and K, can go a long way to reducing these things. Turmeric or curcumin, that supplement, resveratrol has worked for some people, and CBD has also worked for some people as well for this too, so look into that. And lastly on our list is water. If you're dehydrated, you're going to have more inflammation in your body, and a little extra inflammation down in here or anywhere along those nerve entrapment sites, you can be causing some trouble. So there's a lot going on that could cause carpal tunnel syndrome. Dig into this. Let us know if you need assistance. I'm Dr. Scott Fuller.